North Texas is a region that's growing daily. Baylor healthcare system is too. Since becoming a multi-hospital system in 1981, the Baylor Flame has become an institution across the North Texas landscape. There's been much talked about growth over the past 2 years on the Baylor University Medical Center at Dallas campus. In 2011, Baylor Charles A. Sammons Cancer Center opened, a brand new 467,000 square foot outpatient facility. The Sammons Cancer Center is the second largest provider of cancer services to patients in the state of Texas. And now across the street is the new Baylor T. Boone Pickens Cancer Hospital, the region's first ever dedicated cancer hospital, 175,000 square feet, and the result of a $100 million renovation. Baylor recently welcomed 3 new hospitals to the system. Baylor Orthopedic and Spine Hospital at Arlington opened in 2010, the only specialty hospital of its kind in the Metroplex. The new Baylor Medical Center at Uptown opened in 2011. It replaced the Mary Shields Hospital. Baylor Medical Center at McKinney opened in 2012, a brand new 95-bed, $195 million facility. And 2 new replacement hospitals are on the horizon. A new Baylor Surgical Hospital at Fort Worth is planned to open in 2014, and a new Baylor Medical Center at Waxahachie could soon follow. Expansion and improvements are underway at several Baylor hospitals across North Texas. A $100 million patient tower and expansion project has begun at Baylor Regional Medical Center at Grapevine and will be complete in 2013. Baylor's Plano campus has recently grown with a new medical office building and an expansion to the Heart Hospital. Baylor Medical Center at Carrollton is undergoing improvements to its operating rooms. Baylor Medical Center at Garland's Emergency Department was recently expanded. Baylor Medical Center at Frisco's Emergency Department will be expanded in 2013. And Baylor Medical Center at Irving's Emergency Department will be expanded and modernized by 2014. Baylor has grown via partnerships as well. Through a recently developed relationship with Select Medical Corporation, the Baylor Institute for Rehabilitation is today a network that includes 4 inpatient rehabilitation hospitals and soon-to-be 37 outpatient locations. Through a brand new joint venture with Ameris, 8 freestanding emergency hospitals will carry the Baylor name by 2014. Via a partnership with Texas Oncology and McKesson Specialty Health, Baylor Health Enterprises will open a $105 million proton therapy center in 2015. And Baylor's physician group, the Health Texas Provider Network, has also experienced impressive expansion. Its provider base has increased by 38% in just the past year to now include nearly 600 total providers. And it has also added nearly 24 new access points. In the last decade, Baylor Healthcare System has experienced explosive growth. It took 4 years for its total asset base to move from $1 to $2 billion, 3 years for it to move from $2 to $4 billion, and now it's tracking to grow to $5.7 billion by 2013. The trend is clear. The reach of Baylor's nationally recognized brand is expanding just as quickly as the number of communities it serves.